does it translate? Or are we specifically, OTs are stuck in that bottom level of getting them ready for it, but we're not necessarily preparing them for the other levels? Whereas a speech therapist may be far more interested in the social communication, functional communication, social awareness, and teachers then start in on cognitive, but then the professionals get into the more executive functioning. We're each in our predominant area, but we have to look holistically at what are we building the foundation, or do we need to go back a level? So we need to be aware of what each and every one of us has specialties in those areas, but we need to look at the whole big picture and how they relate. And can we tie it in? Hey,
Hi, I'm Stacy Neustadt. I am a speech language pathologist and the CEO at Making Sense of Autism, and I'm a student of Susan.
and I'm Susan Galabach. I am a now retired occupational therapist who has worked many, many years after I discovered even my own autism with other autistic individuals. I founded Making Sense of Autism because of my passion to not only understand my brain and how it worked differently, but to try to explain what I've learned to other people so that they're more understanding and therefore more accepting and more accommodating to autistic individuals.
So, our goal is to help you provide the right support without trying to fix autism, but by understanding it. So, whether you're a parent, teacher, therapist, or just someone who wants to learn, you're in the right place. Be sure to subscribe and join us every week. We talk about a new topic. Thanks so much for joining us this week. Every week, Sue and I talk about a different topic, so be sure to subscribe so you get notifications when we've got a new topic. And this week, we are talking about our neuro-strength-based assessment for all therapists or all professionals, teachers, psychologists, PT, OT, speech. If you've ever felt stuck after you've assessed a client, this is for you. So Sue and I talk a lot about how our assessments really are not siloed, not only for the child, we're looking at so much within the child, but they're not siloed within profession. These assessments can be used by a speech therapist, an occupational therapist, a PT, a teacher, a psychologist, because you're going to use your lens, your professional knowledge in how you're interpreting the information. So when you look at the individual strengths and you're a speech therapist, you're going to be looking at, their communication, whether it's verbal, nonverbal. If you're an OT, you're going to be looking at their strengths as it relates to motor skills. And so while you're looking at the child through these different lenses, you're also seeing the little pieces that intertwine in between. So even when we talk about triggers, it might be a sensory trigger that a speech therapist needs to know about so you don't trigger them in your session. But then also the psychologist knows, okay, this is going to create emotional discomfort. So all of these topics we talk about, they are going to apply to everyone. And these are for all ages because these are skills that you see across a lifetime, as well as all levels of support, whether it is a child who is diagnosed level 3 and maybe they don't have a lot of language, but you still can see how they're trying to communicate. You can still see what types of sensory things do they seek to do. So if you've ever written goals that don't generalize, If you've ever seen skills in testing that maybe disappear or you only see them in certain contexts, if you've ever felt like you're working so hard, but you're not making progress, these assessments are for you. Is exactly why we developed the neuro-strength-based assessments, the strengths, stressors, and supports, and our soft skills assessment. And if you're a speech therapist, we look at receptive language, expressive language. And even though we don't assess those skills specifically, you'll see how they show up. You'll see how maybe the child uses gestalt to communicate what they want. Maybe they're great at following directions at home. And these are all things that you're going to learn about the child through these assessments. So, Sue, when you think about as an OT, you assess for, I remember the, visual motor. I know you guys do have the sensory profile, which is awesome. And I use that as a speech therapist as well. But as an OT, what information is an OT going to get from these assessments?
I think when we're talking about visual motor, the skills that the individual has, we look at how do they process information? That's the sensory component. How are they able to respond? How well can they coordinate their movements or their eyes with what their hands are doing? If their eyes are over here and their hand needs to go here, it's out of sync. So yes, a lot of it is sensory processing and of course the motor coordination that involves the two sides of the body. How can you share information from one side of the brain to the other if you don't have coordination? So it does look at the whole child, but those still are skills that we're working on as an OT. And if we don't understand how that child learns, how the child is able to deal with the sensory information that comes in, how can we teach him? Yes, we do a lot on the lower level of self-awareness and body control that flows over into emotional regulation. So OTs, that fits in a lot more with their background than, say, speech therapists. But we don't always know that it can lead to, and as a foundation, how does that apply to their cognitive learning skills, their social interactions, their functional communication, all of which are primary for autism? Those are the skills that everyone wants to see an autistic be able to learn. Does it translate? Or are we specifically, OTs are stuck in that bottom level of getting them ready for it, but we're not necessarily preparing them for the other levels? Whereas a speech therapist may be far more interested in the social communication, functional communication, social awareness, and teachers then start in on cognitive, but then the professionals get into the more executive functioning. We're each in our predominant area, but we have to look holistically at what are we building the foundation, or do we need to go back a level? So we need to be aware of what each and every one of us has specialties in those areas, but we need to look at the whole big picture and how they relate. And can we tie it in? Hey, an OT can certainly tie in language.
Absolutely.
With what we're doing. A speech therapist can absolutely tie in awareness of, oh, look what you did. And gee, I noticed this about you. I mean, they can back down and integrate that into what they're doing so that you're teaching the whole person. You're looking holistically at that individual. And that's the neat thing about these assessment tools. They're individualized. They don't compare you to anyone else, unlike standardized testing that compares where do you fit developmentally compared to other children that aren't even like you. This is purely an individual assessment. It helps you get to know that individual, what is unique about them as far as their strengths, their stressors, and how they learn.
And I think about for teachers, they work on cognitive skills, work on learning all day, but that includes communication and that includes sensory and attention, which includes that self-awareness. Am I paying attention? Am I focused on what I'm learning? And then emotional regulation. And while, as a speech therapist, I think about our terms we use like receptive language, expressive language. And when I think of receptive language, I don't even really assess for that anymore because there's such a giant under the iceberg. So like if you picture on the top, you've got receptive language, but underneath, if they have poor auditory processing, if they have poor body awareness, if they have poor sensory regulation, you're not going to figure out their receptive language because they can't even attend to what you're saying and process it. And so how do you really assess for skills when there's so many variables to that? And so like when I'm looking at receptive language, I really look at things that they're motivated by and are they able to process different things that I say to them when their body is regulated? And I feel like even again, when we're looking at their strengths, if a family puts in there, what they do independently, like they follow commands or they'll do chores or they get dressed and I ask, okay, how did they learn to do that? Well, that's receptive language too. Visual, a lot of times I hear, oh, I showed them over and over again. Well, that's going to give me a lot of insight into how they learn things and language receptively. And I would think that would give the OT information too, that when they see the movement over and over again, they're able to match that movement and do what, as well as PT too. And really, again, the reason I'm bringing this up is because think about it. How does this kid learn? That gives the speech therapist information, the PT, the OT, that gives the teacher information, and then the psychologist as well of how their brain learns best. And so really the assessments, we're sharing this because it really truly is for all professionals because it gives you insight to the child from each of these lenses, but in your specific career. And then with the soft skills assessment, which I'll share my screen so you can see the tool we're talking about. And this is in our soft skills assessment. And Sue, share a little bit. Okay, so we have talked about soft skills, but if you're new to us, what are those soft skills and how do they impact us professionals trying to teach a skill?
Those soft skills are things that individuals pick up intuitively. They simply observe, they notice, they figure things out. And then okay, I know if I do this, this is what's going to happen. And so, but if I do this, I'm going to get better what I want. Those are things that no one teaches you. You pick up on your own. But if the autistic brain functions to where it takes in all information, can't filter it out, we're overwhelmed, we don't know what to do with it, we can't figure out what it means. So we end up being confused and then unable to know how to respond. But so in order to learn, we have to hyperfocus. We have to learn how to block everything out except that one thing that we're focused on. Well, then that means when we're in the hyperfocus mode, we're missing a observing or noticing things that everyone else is paying attention to. This is why when you'll ask a question and someone will say, everybody knows the answer to that. Everybody knows that. Well, how does everybody know it? Obviously, I don't, because they picked it up through just merely observation, through experience. Something happened to them and oh, okay, and they learn from it, but they figure it out. But if the autistic is missing picking up those soft skills, those street smarts, as you might call them, then they're clueless. And yet that lays the foundation for so much other learning, especially social interactions. And so you've got to kind of start down at the bottom. How aware are they of even themselves? You have to start with the foundation of knowing who you are, what you can do, what you can't do, what you're able to control and what you're not able to control before you can get into paying attention to other people. Well, how are other people like me? How are they different from me? How do I communicate with them? Now you're starting to learn from other people and from what's happening in your environment. It's not all self-focused. But if you don't have a sense of self to start with, you don't have the foundation. You're going to continue to always be me, me, me. I need to do it. It has to be my way. I have to be in control, because you're still stuck in that. You haven't learned who you are. And how many parents, professionals ever stop to teach an autistic what it means to be autistic? How my brain works differently. No, the expectation is, no, you're like everybody else. You have to learn to be like everybody else. So instead of teaching them about how the autistic brain functions and how they can work with the way they are, and that they have strengths and that they have wants, things they want to learn, that they have triggers, stress triggers, things that everybody else just knows what stresses them. But an autistic needs to be able to have someone help them focus on themselves and know this about themselves, so they feel in control and they understand themselves. Now they can reach out. Now they can look outside of themselves to get into. They're ready now for social and functional communication and learning from other people, the skills that you want to teach them.
And I want to point out that even though, yes, as speech therapist, this is up here, but if we're still working down here, that doesn't mean we're not using communication. What we're doing is naming and building the language and the self-advocacy for some of this down here. Think about our kiddos with higher support needs. They are down here. And so think about the language that they need. They need to have self-advocacy language to advocate for the headphones, to advocate if they don't want to go into a certain place because it's too busy or too much. That advocacy for emotional regulation. What do they need when they're dysregulated? And so we're working on and inviting them to use language down here. So really we're modeling functional communication, but on topics down here. I had a family that I work with that when I started with them, they were shocked at how I did therapy. They're like, the last therapist just kept saying, touch your nose, touch your head. And I'm like, that is not functional. And I'm sure it was really boring. And I'm sure that they were getting really upset. And they said, yeah, my kid did not like therapy, which we needed to work down here. The kids needed a lot more awareness of themselves, awareness of their emotions and their body and their sensory. They're very, very sensory seeking. And so we explore different sensory things, talk about what we like, I don't like. And this kiddo now is saying, he's advocating, I don't like. And so I have kids who verbally say it. I have kids who just use gestures. So know that this applies to all support levels and all professions. And again, this is such a learning process. And that's why Sue and I are here. That's why we pop into your email every week, because it is a journey. And even just learning one little thing and trying it out each week in your therapy sessions, in your teaching sessions, try it, come back to us, let us know how it goes. But you are going to see a difference because the child is going to see, oh, you're meeting me where I am because you understand where I am. And that's really what these assessments show is, where is my student or client? How do I meet them there? And the supports that I provide. So we hope that you really see how this applies to your profession, how this applies to no matter what age client you work with, and the support tools that are included with all of this as well, is so many different support tools. So we hope that you see how this can apply to your profession as an SLP, as an OT, as a teacher, as a psychologist, and you can use these tools.
And wouldn't it be great, Stacy, if this is one assessment tool that you can share with parents, their teachers, their the psychologist, because it's going to be meaningful, because it talks about the end, getting help to know their individual. If you were to share your test results on speech, as an OT, I would look at it and say, oh yeah, okay, I don't know what to do with this because it's not my field. And the same thing if I share the assessment as an OT with you, you would think, well, that's fine, but that doesn't apply to me as a speech therapist. But this does. This because it's looking at that individual and how they learn, how they function, what they're ready to learn, and what they still need to focus on. And that's valuable information that can be shared with everyone.
Absolutely. So our course opens on February 24th. We put all of our assessments and our tools in a course to teach you how to observe these different skills, to teach you how to support these different skills. And the course opens February 24th. So mark your calendars. Be sure to sign up for our emails so you know when it is live and you get the early bird price. But you don't want to miss this because, like Sue said, when you present this information, you're giving the picture of the whole individual. And so everyone can take a little bit from these assessment results. So be sure to follow us each week and mark your calendar for February 24th. And if you're watching this in the future and you missed the course, we open this a couple times a year. So be sure to just follow us. All right. Thank you, Sue.
Thank you, Stacy.